It is my pleasure to present to you our Patient and Carer Experience Annual Report, including complaints and feedback for 2024-25. The Trust is committed to actively engaging, involving, hearing, listening to and acting upon feedback. And we hope this report demonstrates the significant strides we are making to involve everyone so we can provide the best outcomes possible for our patients, service users, their carers and families.
As Medical Director for the Trust, I oversee the Patient and Carer Experience Agenda. I would like to introduce you to the Patient and Carer Experience team, who would highlight what we have been doing over the past year.
There is an intrinsic link between staff satisfaction and the direct impact on patients and the standard of care they receive. The Trust's 2024 staff survey ranks our Trust as the top trust to work for in the region, sharing a very positive picture of staff experience, which directly enhances patient care and satisfaction.
Our experts by experience are people with experience of using services as either a patient, service user or a carer, and once registered on our expert by experience database, are paid for undertaking activities within the Trust. During the past 12 months, 32 individuals have been involved in Trust projects and initiatives where they have been paid for their contribution.
Patients, service users and carers continue to provide feedback by participating in a number of surveys including Friends and Family Test, Community Mental Health Service User Survey and the National GP Survey. Feedback is shared with staff and where learning is required, action plans are produced to make improvements.
The Trust has started working on the Patient and Carer Race Equality Framework, which all providers of NHS mental health services must use to support their organisations to commit to and embed anti-racist values throughout the organisation. This is needed because national and international data show that both access to mental health services and the treatment people will receive can vary by ethnicity.
At Humber Teaching NHS Foundation Trust, you put me at the heart of everything you do. Thank you. I am proud to be a service user carer governor amongst several other voluntary roles within the Trust. I really do feel that my voice is listened to and heard.
As Health Watch managers, we work in partnership with the Trust to ensure the voices of our communities are heard.
Our close working relationship helps to ensure that you are understood, to influence and shape the services that the Trust delivers.
October saw the launch of the Children's and Adults Learning Disability Services Connect website, which hosts 28 children's and learning disability services in one platform. It offers easy access to important information and features animations co-produced by service users and the individual services.
We're excited to celebrate the second year of our Humber NHS Cadet Programme in partnership with St John's Ambulance Service. This initiative offers young people a tailored opportunity to explore careers within the NHS. This year, 22 young cadets, many from diverse local backgrounds, will graduate the programme.
This year, the Learning Disability team worked alongside 5 registered experts by experience over 3 different projects, including the Culture of Care project at Town and Court, Cancer Screening project with Bridlington Primary Care Network, and educating students at Hull University about family therapy.
Being able to be paid to share my experience and connect with professionals is amazing. I feel like I'm really helping make a difference to the services I have been a part of.
Staff and volunteers have curated a collection of artwork displayed throughout Whitby Hospital, showcasing its rich history. These pieces offer patients and staff a unique opportunity to explore and learn about the hospital's heritage and the surrounding area's fascinating past. On the back of the 2024 National GP Survey, the Trust's 3 surgeries have introduced a new telephone system and an online booking and consultation system. All actions from the survey are developed with the practice's patient participation groups.
A patient is leading a project to raise awareness and improve the resources and information available, particularly for inpatient services, about the 9 protected characteristics supporting equality, diversity and inclusion. A work experience initiative has supported several inpatient service users working in the on-site shop. This has led to a further project looking at volunteer roles for inpatient service users in the forensic division. Staff and patients will be training together to gain the Level 2 food hygiene qualification. This will enable both groups to share good practice and support the preparation and cooking of food together on the inpatient wards once achieved.
A carers card has been designed to connect carers and families to support available within our communities. By having a business-sized card including relevant information to hand when needed will encourage more individuals to access support services. De-escalation, management and intervention training has been enhanced by the introduction of lived experience films to make it more meaningful.
Being an expert by experience has had a positive impact on my life and mental health recovery. Feeling confident to openly share my experience of mental ill health has felt empowering and motivates me to stay well to continue to contribute.
This year, the Trust responded to 502 complaints, 188 formal complaints and 314 informal complaints. This is a decrease of 52 complaints compared to the previous year. Communications and patient care are the top primary subjects. The Trust implements actions from complaints which are upheld and partly upheld to improve our services. Of the 188 formal complaints responded to, 43, 23% were upheld, 70, 37% were partly upheld, and 75, 40% were not upheld. For the previous year, the Trust responded to 198 formal complaints, of which 60, 30% were upheld, 56, 28% were partly upheld, and 82, 42% were not upheld. 47 of the Trust's 133 clinical teams, 35%, have not received any formal or informal complaints in the last 12 months. This remains the same percentage as the previous year. The Trust received 432 compliments this year from patients, service users and carers, which is an increase of 129 on the previous year. The Complaints and Feedback team offer training to ensure our staff understand the complaints process and are equipped to manage complaints and concerns as they arise. Over the past 12 months, 229 staff accessed this training.
May we take this opportunity to thank each and every one of you for your continued support on this very important agenda. Your involvement is key to ensuring you are at the heart of everything we do.